We provide bold,
legal insight and business leadership
to forward-thinking people and organizations.
We believe in better
and bold outcomes
and meticulous focus
in finding the solutions others might miss.
By building our practice around the best minds in the legal profession.
And outside of it, too. We believe the pursuit of better starts with people.
Our colleagues, our clients,
and the people who depend on them.
We are committed to truly understanding
the individual needs
of those who depend on us,
so we can help them go from where they are
to where they want to be.
We are.
We are.
We are.
We are.
We are.
Husch Blackwell.
Husch Blackwell.
Husch Blackwell.
We are Husch Blackwell.
Great. Good afternoon or good morning, everyone, depending on where you are in the country. Thank you very much for joining us here at Husch Blackwell. My name is Tom O'Day. I'm a partner in our Wisconsin offices. And joining me today are a number of colleagues from our Huschwell offices across the country. Before we begin, I'd like to cover a few housekeeping items. At the bottom of your audience console on your screen, there are a number of multiple application icons for use during the program. If you have any questions specifically for any of the presenters during the webcast, use the Q&A icon to submit. If you would like to share experiences with everyone, please use the attendee chat icon during the webcast. And in order to access that icon and others, you have to click those little arrows next to the buttons that you'll see in that console. We'll try to answer all the questions that come in throughout the webcast today, and we're hoping for a very participatory discussion. But in the last webinar we had something like 300 questions. So we may not be able to address all of them, but we'll try and incorporate those into the presentation as well, including those that were sent to us ahead of time. One of the questions that we'll get is that request for the actual presentation slides. Those will be available, and they are available right now in the resources folder that you can access on your console as well. This program has been approved for legal education hours. To report those hours, click the CEU icon at the bottom of the screen, and a certificate of attendance, including the course numbers, will be emailed to you tomorrow, along with the recording of the webcast for sharing and watching. Toward the end of the program today, please be sure to complete our short survey. We do really value your feedback and use it to plan future programs that are applicable to your needs. So to the extent that there's a subject or topic that you'd like us to cover, please do encourage and use that survey in order to encourage us to do so. So joining me today is Carrie Claiborne, Julianne Story, and Barbara Grandjean from across our offices at Husch Blackwell. Before law school, Carrie worked as a human resources professional at a university. She brings that insiders and practical perspective to her labor and employment practice, helping anticipate issues and reduce liability. She now counsels employers and with compliance in a broad range of employment laws. Julianne is an accomplished litigator and advisor who has advised a number of healthcare entities as well as other large clients across the country. She has a deep understanding of the challenges that employers do face in the world of human resources. In addition to trying cases in state and federal court, Julianne provides strategic counsel to clients navigating that ever-changing landscape of employment issues and human resources law that we deal with. Barbara consults proactively with employers regarding workplace issues such as hiring, firing, and discipline, including harassment, discrimination, retaliatory, and privacy and social media issues. Focuses on a number of other areas that, for the most part, each of us on this call and within the Husch Blackwell team work through. So again, thank you very much for joining us today. Again, we really are hoping that this is a very participatory discussion. The purpose of this webinar is not the substance necessarily, but really in addition to that, the discussion. In order to do so, we'd ask that you please identify yourself or the entity you represent when asking questions only with your first name. Don't include any of the detail, maybe just a general reference to the general area of the country that you're from. We don't necessarily want people to feel like they need to share all their information with us in order to ask these questions. That said, we do have just a handful of kind of introductory questions for us so we can get to know our audience a little bit. We'll have polling questions throughout the discussion today. So you should be able to click one of the two buttons here whether you're a healthcare or a non-healthcare industry employer. And we'll let these populate a little bit and then move on with some of the results that we can all see. Again, if you want to ask questions, there's a Q&A box in the console. And if you want to have any kind of chat throughout the process and the discussion today, you can certainly use that as well. So we'll see what we have so far. So we've got about 43% healthcare, 56% non-healthcare. So welcome all. Another question, just to get us, again, a sense of the audience, how large is your organization? So use one of those buttons, fewer than 100 employees, more than 100 employees.
And Tom, if anyone's confused, they're just clicking right on the screen, right? With the mouse on those little video buttons. I was confused the first time, so just throwing that out there.
Yep. All right, let's take a peek. So we've got roughly, 82% with more than 100 employees. Great. Well, that's helpful just for us as we talk through some of these issues. Again, we anticipate this being very participatory. We had a webinar, I think a week ago or so, September 21st. That webinar had a lot of detail, a lot of substance packed into it. That webinar is available on our website, similar to this one, where we've got around 1,300, 1,500 participants. We had a large number of participants for that, as well as the questions that came through. The religious exemption questions were some of the more prominent questions, and that's why we thought we'd put together this event today. We also put together an alert that went out last Friday when the Biden administration released the first formal guidance following President Biden's press conference, where he indicated that he would be requiring the vaccine for those employers over 100 or the healthcare employers tied to Medicare or Medicaid. So we've got a release out on that. It's informative just for a couple different reasons that aren't necessarily related to religious exemptions, but certainly we have at least some sense now of what the Biden administration is thinking with respect to some issues related to the vaccine. So check that out on our website as well. The topics we'll touch on today are really driven at that religious exemption, and we're going to move through these relatively quickly and leave time at the end for the questions to address and for you all to share experiences. So you see the topics there. We'll run through Title VII of the Civil Rights Act. We'll touch on the accommodation requirements that go along with that federal law. We'll talk about that undue hardship standard and what that might mean for you in healthcare and non-healthcare enforcement and practice. We'll talk about the state laws, and that's one area where we got some guidance from the Biden administration this past Friday. And then finally, again, we want to get into sharing some of our experiences that we've seen with our clients, but also hear from you about the experiences you have and get into some of those detailed questions that you might have as well. So with that, I'm going to turn it over to Carrie and take us through Title VII.
Thanks, Tom. So as Tom mentioned, we're primarily focused on religious accommodations here. So I'm going to do a little, just brief kind of legal overview of the parameters of Title VII. So first, it boils down to two key provisions related to religious discrimination under Title VII. I'll get into a little detail about it, but first, it prohibits discrimination and which includes harassment based on a person's religion. And then second, Title VII requires an accommodation unless doing so would pose an undue hardship. Julianne's going to talk more about undue hardship, but those are the mainly what we're focusing on and how religious beliefs come to play here with COVID and vaccinations. Religious discrimination, like all kinds of discrimination, involves treating a person unfavorably, and that includes employees as well as applicants, and in this case, because of the person's religious beliefs. Again, I'm going to go in a little more detail, but it's important to note, if you forget, if there's nothing else you're going to deal with, religion is broader than, the classic organized, traditional, recognized religion. So when you get your requests for religious exemption from the vaccine mandates, what are you supposed to do with it? There's a two-step analysis. I'm going to focus on the first part, but the two steps are: first, you're going to ask, is the employee's religious, ethical, or moral belief, so a little broader than religion, is it sincerely held? And second, is an exemption from the vaccine mandate an undue hardship? So let's look at the sincerely held part of this. Up to this point, religious requests for accommodations, typically, maybe many of you have experienced this, are rarely requested, and the EEOC guidance and case law is generally very deferential to a person's belief and whether the question of whether it is sincerely held. So this quote from the guidance from the EEOC, this is really sort of like how, practices have developed in addressing requests for accommodation. Therefore, the employer should ordinarily assume that an employee's request for religious accommodation is based on a sincerely held religious belief, practice, or observance. That's the general default, is you're going to assume it's sincerely held. There are some reasons why you might be able to push back, and now we're seeing this a little bit more. I've seen this, some of you are probably dealing with this and questioning it, but the volume of requests based on the COVID vaccine or testing, I saw a question come up: is there a valid basis or religious belief that says you can't test? So, we're all kind of, based on what you're getting, wondering, like, really, is this sincere? Do we actually have to accept this? And like the guidance has been, just assume it's sincerely held. Generally, yes, but unless there's some kind of objective basis to question it. What would be an objective basis? I mean, this is tough, but mostly if people, maybe someone has contradicted themselves, or there's evidence of that person stating that it's not sincere, that their motivation is really just to get out of getting a vaccine, or truly based on political reasons or something like that. But otherwise, by its very nature, religious beliefs are changing and not always subject to objective scrutiny. So some other things to think about, and when we get into more examples, I think this will play this out a little bit, whether things are sincerely held, but it's important to know also a belief can be unorthodox or even unsanctioned. So yes, Title VII protects the more traditional recognized religions that we're all familiar with, but it also is very broad and covers certain beliefs that you maybe have never heard of before or might consider really off the wall. Those are still potentially protected under Title VII. And then unsanctioned as well. So maybe it is a recognized religion. I'll just use the example of the Roman Catholic Church. For example, someone may come forward and say, I am a devout Catholic, I cannot get the vaccine because I am Catholic. And you might say, no, I'm Catholic, and that is not true. And you're really going to push back and question their belief. The problem is, up till now, Title VII, it has evolved to protect a belief, even if it's not exactly matching up with the doctrine of that established religion. So there's not a lot of room to push back on sincerity. The one thing I will say is social, political, or economic philosophies are not protected. This gets a little sticky. Tom's going to talk about some of the state laws. So there are some other laws that might protect those types of beliefs and philosophies that aren't considered religion. But technically under Title VII, something that's not religious, but instead political or economic philosophy would not fit. With all of that being said, I'm going to ask a poll question for you. So has your organization received requests for exemptions to, there's two questions. The first one is about vaccinations. So we're curious, and I'm sure you're curious about others as well, who is receiving requests for exemptions to the vaccine based on a religious belief? If you can answer yes or no. We gave you two options, yes and no. I suppose another one might be we don't know, but in that case, I would just click no.
Carrie, while they're running through that, a couple of the questions have focused on your comment about the Catholic Church and the idea that the Pope, the head of the Catholic Church, has said that vaccines are okay and that Catholics should do that. It's important to remember, like Carrie said, and just emphasize, an individual may have a different understanding of their own individual faith that can lead to valid, sincere religious belief that would require that kind of accommodation. So that's something to keep in mind for folks.
Yeah, that's exactly right. And there are opportunities to question, like to engage in a discussion. You know, Title VII and the related case law allows for that. But there's a limit to what you can push back on, and really whether you want to push back on what the belief is something to consider. So I'm going to go ahead and look. Oh, really? Even 50-ish. Whether you've received those requests. Okay, good to know. So the next poll question, a little different, but has your organization received requests for exemptions to testing based on a religious belief? So as an alternative to vaccinations, people may have implemented testing requirements. We're curious if you've received any requests based on testing. I've seen this, and I think it is a little shocking at first to think that this could be valid. But the question is whether the belief is sincere. We're not to the next part, which Julianne will talk about, undue hardship. But as far as sincerely held beliefs, a question we got also is related to this, whether each of these requests should be treated on an individual basis. Yes. So if you're getting requests for religious exemptions, you may already kind of know what the answer is going to be. Maybe you have a policy in place. Be clear what your options are. But under the law, you would still need to address each request individually and consider whether there's an accommodation you can provide. Okay, so we'll go ahead to the responses. Okay. Mostly no one has received, the 10% of you that have received these are very challenging, I'm sure. And so this is good to know. I think once the rules come out, you know, this is likely to flip-flop a little bit, but thank you for submitting those. Now we are going to go to Julianne to talk about undue hardship.
Thank you very much, Carrie. I'm Julianne Story, and I sit in the Husch Blackwell office in Kansas City, Missouri. And I'm going to talk about the second step of the religious accommodation analysis, and that is whether or not the accommodation requested here, exemption from a vaccine mandate, poses an undue hardship on the employer, the employer's operations. The Supreme Court has said that undue hardship under Title VII, although the terminology is the same as under the ADA, under Title VII, it's actually easier for the employer to show undue hardship. Under Title VII, undue hardship is defined as more than a de minimis cost or burden. Even trivial is some of the language used in the opinions. And that's an easier standard than under the ADA, where someone's requesting an accommodation based on disability, and the analysis requires undue burden or expense. In the earlier this year, in May of 2021, the EEOC suggested some considerations for employers to keep in mind that was relevant to the undue hardship analysis under Title VII. The EEOC's guidance suggested that considerations such as the proportion of employees already vaccinated, among other things, the proportion of employees in the workplace who are already fully or partially vaccinated or who had COVID. The extent to which your employees might have contact with non-employees whose vaccine status was unknown. There is some question, however, now as to whether or not this statement from the EEOC is outdated, because now we know in more recent statements from President Biden and OSHA that there seems to be some recognition that just because someone is vaccinated doesn't mean that they aren't in grave danger of contracting COVID. So when we think about additional considerations that might warrant a determination of undue hardship, the risk of unvaccinated employees' own exposure to COVID-19. Unvaccinated healthcare workers are at a greater risk of exposure to COVID-19 themselves. There's also the risk to patients. Unvaccinated workers have a greater risk of transmitting COVID-19 to vulnerable patients who are often immunocompromised or unable to be vaccinated, either due to age, health condition, or other vulnerabilities. We have data now on the cost of healthcare services if an unvaccinated worker contracts COVID-19. The cost of caring for somebody who's hospitalized is in the range of $50,000 or more, potentially significant costs to the healthcare system and the employer. In addition, we have OSHA and some states that have published statements that COVID-19 presents a grave danger. And in New York State, you may have read that the legislature has determined that COVID poses such an extreme danger that they will no longer be granting accommodation to healthcare workers based on religion. And echoing something that Carrie said a few minutes ago, one of the things that has not changed in the guidance is that each request for accommodation must be managed and assessed on its own facts. Each accommodation should be addressed on its case-by-case analysis. So what are the other potential accommodations if it is determined that an exemption from the vaccine mandate is an undue hardship? What are the other possibilities that might exist for accommodating the employee without posing an undue hardship? Masking or distancing, regular testing. I've seen some of the questions. We're going to talk about testing later, but one of the big questions is who pays for the test? Who pays for the test? Who pays for the time getting the test? These are questions that we hope the EEOC or OSHA, Department of Labor, will soon answer. But right now, reasonable minds can differ. A DOL says that's probably something that if the time spent is required for work, the employer ought to pay for both the test and the testing. The others say, well, we wouldn't pay for you to go shopping for steel-toed boots that you need, so we're not going to pay you for the time that you spend buying or getting the COVID-19 test. Removal from patient care roles, that's another one. Restrictions within the facility where the employee works to limit their access to others who may not be vaccinated or who are incapable of vaccination, like patients. Remote work from home is a very common request for accommodation, particularly in non-patient care roles. Unpaid leaves of absence is another one, particularly if that's a possibility if the condition is going to resolve. What about health insurance, though? What about other group benefits that the employee offers if there's an extended leave of absence? And then, of course, if the conclusion is reached that there is no reasonable accommodation or the requested accommodations pose an undue hardship for the employer, then you're looking at the termination of the employment relationship.
One additional thought, Julianne. One thing that I've been recommending for clients is, even if you're going to grant religious exemptions, call it an undue hardship. It is an undue hardship. And if you do grant it for a period of time, make it limited. And we may have a new vaccine that doesn't have any tie at all. And it's a question we'll get to, and a lot of questions are asking in the chat, but we may have a new vaccine that has no tie to fetal tissue. And that may be the reason why people who may have otherwise objected for religious reasons should be able to get a vaccine in the future. So I've been recommending, make your undue hardship case in the letter where you may grant the religious exemption, and only make those grants for a limited period of time, and reserve the flexibility to change your mind going forward.
Good advice. Thanks, Tom. Some of you may have seen these headlines as the first airline to mandate the COVID vaccine for its employees. The early reports were that significant numbers of United Airlines staff had been granted religious exemptions for the vaccine, specifically being put on unpaid leave. More recently, they've touted the high rate of vaccination. And then yesterday, they talked about approximately 600 employees will likely lose their jobs for refusing the vaccine mandate. As the third headline on the screen shows, though, even if an employer follows the rules, there's no immunity against claims. And then one other point that I think it sometimes gets forgotten is that keep in mind that Title VII also prohibits discrimination and harassment against someone because of a person's religion. And to the extent some employees may be harassing a coworker who has had a religious exemption granted, it could lead to a complaint by the unvaccinated worker. And even if the employer followed all the protocols in place, there is a risk of a potential claim and liability. So remember that just like in any Title VII claim, the employer's liability for coworker behavior will turn on whether the employer knew or should have known and failed to take prompt and effective remedial action. So another topic that I wanted to cover, which is coming up more frequently, and I can see in some of the questions, the issue of what to do about non-employed service providers who come on your premises. And here we're talking about independent contractors, consultants, employees of temporary staffing agencies, and students, anybody who comes on your work site. In general, companies don't have the same level of obligations with respect to third-party service providers or independent contractors as they do with their own employees. So what we're seeing in the COVID environment is that just like with non-discrimination laws and wage and hour compliance, employers are shifting responsibility for considering and resolving employee requests for accommodation to the employer of those non-employees. Then you have the question, if you do get involved, who will track the vaccination status and exemption requests? Will it be you or the service provider? We know that, the person's vaccination status is confidential medical information. So the cards that employers require of proof, there's limits on that sharing, which would require consent of disclosure. And if you do get involved, then beware of the joint employment implications of getting involved in that process of as to the non-employees on your premises.
Hey, so Julianne, real quick before you move on, we are getting a lot of questions about the comment you made about considering these on a case-by-case basis, even if we know the outcome is going to be that there's an undue hardship. Can you talk about how important the interactive process will ultimately be if there's a claim brought?
Yeah, I think that's applying the normal processes that we're familiar with under Title VII and the ADA, both statutes that require accommodation. It's all about the process, right? You have to explore on an individual case-by-case basis what the employee's job involves, whether or not there are other accommodations that might allow the employee to do the job without posing an undue hardship on the employer or the employer's business. It may ultimately be that you determine there is no reasonable accommodation, or that the reasonableness is intertwined with undue hardship. There either is no reasonable accommodation or the requested accommodation poses an undue hardship. But even if you reach that conclusion, you still must have gone through the individualized analysis. Hopefully that answers some of the questions coming in on that topic, and if not, we can cover it later in the presentation. So we have a poll question here. What type, if any, of vaccine policy has your organization implemented? 1, a full mandate requiring all employees to be fully vaccinated, or a soft mandate with the option to test, mask as an alternative, or we have only offered incentives but no mandate. And lastly, we have not implemented any mandates or incentives and do not plan to implement a mandate unless required by the government. And here, looks like most of you have not yet implemented any incentives or mandates, and are going to wait and see what the government does. I think Barb is going to talk a little bit about the wait and see approach versus being first. Otherwise, looks pretty evenly divided. Here's another question. If you have considered requests for accommodation from contractors or other non-employees, have influences outside your organization influenced whether you considered the request reasonable? In other words, did your business partners help you formulate your policy? Yes, no, we have received requests from non-employees but are not considering accommodating them. And finally, we have not received requests from any non-employees or contractors. And while you all are voting, we did have a question. In a setting that a federal contractor hires temporary agency employees, who has the burden of accommodation review if the site will require vaccinations? And I think that's sort of what I was saying a few minutes ago. For the time being, until we have more direction from the government regarding the new federal contractor rules, which is expected sometime in the first half of October, it would be the temporary agency as the employer of the workers who has the primary burden of conducting the accommodation review. I do have clients, though, who are subject to the requirements of their business partners, and if you're in that situation, you know, as the site, you should communicate your rules and make sure that your vendor or contractor can affirmatively certify that they are in compliance of your vaccine mandate. And it looks like the majority of you, over 70%, have not received requests from employees or contractors. So that is a good thing. Makes things a little bit easier anyway.
And that's although you have not yet received those requests, if you do have those kind of relationships, it's worth starting those discussions and starting to plan for those to come. And when the federal, a couple of the questions we've had are, do we have to allow our contractors to be part of our process? Right now, for the most part, the answer is no. You as a business can decide with your partners how you're going to work through that process. The government may have other thoughts, and we'll see that when they release their regulations. But it's really a relationship, a business relationship that you can start building right now, even if you have not yet gotten to that point.
And just to add on that topic before we move on, we're seeing this quite a bit in healthcare where there may be a physician practice, for example, and people have privileges at a hospital. What's the hospital's position on unvaccinated people coming in? In some instances, the hospital says, we'll consider the exemption ourselves, come on in. In other instances, the hospital says no, and then the practice has to manage its staff so that only vaccinated physicians are going to that hospital. So it can really have a big impact on how you want to handle your own vaccination mandate.
And there are some related questions. So on top of what Barb's saying, just, if it may depend once there's a federal rules, or if the state has rules, that could also dictate what your options are for anyone who's unvaccinated. A volunteer, a student, a resident, or a physician could be governed by whatever the rule is and what your options are.
Yep. And that's a perfect transition, Carrie, to those state laws, because one of the areas where you may have some obligations for contractors and other volunteers or students who are coming into a healthcare facility is in these individual state laws. For the most part, you're looking for a couple different things with respect to different states. First is, are there protections under the general anti-discrimination law for religion in your state? There probably are. And is the analysis in that state any different than it is under federal law? Does an undue hardship under your state law or your state's laws differ from the undue hardship test at the federal level? I'd say probably not, but it's probably worth taking a peek at and making sure that you're still compliant with those individual state laws. Some states have gone beyond kind of religious discrimination. Montana is the current state that has said private employers are prohibited from requiring a vaccine. There's certainly pending legislation in a number of other states that has not yet passed and been signed into law. But some states, for you public employers out there, have banned vaccine mandates in the public sector for government employees. Some states have dealt with this by talking about access to public places of accommodation and requiring vaccine passports in order to get into public places of accommodation. So those are all state laws that you have to be conscious of. Thankfully, at Husch Blackwell, again on our website, in addition to finding our past webinars, some of the alerts related to the federal contractor issues, we have been tracking individual state laws related to COVID-19 that you can find on our website. I believe on the web page, on the front page, the home page, there's a little blue button, I think it is, that says COVID-19. Click on that and you should have a starting point for some of your discussion. Right of conscience laws at the individual state level are also something that's starting to come to the forefront. Some states have statutes where the legislature and the government have said a person can be protected in their conscience. They can be a conscientious objector, not necessarily tied to religion, but if it's a very sincerely held belief, non-religious even, that may be enough for a person to reject some kind of requirement that is forced on them or as a condition of employment. These rights of conscience laws appear in state statutes. Some of them are in state constitutions, in constitutional provisions. So you'll have to check out your individual states for those as well. And again, we're preparing the survey of different state laws with respect to those right of conscience laws. And then, like we mentioned, other state laws that may apply to healthcare workers specifically. We mentioned the New York law. In Colorado, there's a law. And Barbara, I know you deal with that fairly regularly, but at some level, they're allowing for religious exemptions. But if you're licensed by the department in Colorado, you have to get a waiver essentially from the state in order to allow for exemptions. And a couple of the questions that have come in as we've been moving through the webinar have requested information about, do we really need to authenticate these religious requests? Or can we just grant them all, make them all test, make them all mask, and maybe take some other action with respect to an incentive for those people to actually get vaccinated? The answer is you probably should have some base level of authentication and documentation that the religious request was legitimate. And for those states that currently require it of healthcare workers or other types of employees in other industries, they're probably going to be looking for some kind of documentation. We don't know what the feds are going to request as part of their new regulations, but they probably will want to peek at some level of documentation of the actual religious accommodation request.
And just to piggyback off of that, as far as the sincerely held piece, I wouldn't want it to be to confuse anyone to think you should be like getting certification. The belief is sincerely held, like you must get this from a pastor, or I need a certified letter from the Pope, but that it's more documentation for your organization to, document what was asked and what was granted. If that, just to, avoid additional confusion.
So one question that we've got now some guidance on is the preemption of these state laws. So if you have a right of conscience law, if you've got a law that prohibits private employers from requiring COVID vaccines, does federal law preempt that? The answer is probably yes. And in Bloomberg, I thought this was a fascinating article because they talk about the conundrum for employers that are stuck between a state law and a federal law, and what do you do? And it's a conundrum for sure. And Bloomberg talks about how those employers in those states are prime targets for litigation. And that's probably accurate. That said, just this past Friday, the Biden administration released its rule for federal contractors. And with that rule, they specifically addressed the preemption question and said federal law supersedes state law. That general rule almost certainly applies. Unfortunately, it doesn't mean you're going to get a pass on any litigation, and the litigation from those employees is still likely to come. But when we get the rule from CMS, when we get the rule from OSHA, I fully anticipate the federal government saying federal law supersedes, and you don't need to worry about those state laws at that point. That's what the federal government is going to tell you. I tell you, you still need to manage the employee relations side of that, and as best you can, try and avoid the litigation that likely will come. So another polling question, how has your organization addressed objections to vaccination or testing requirements based on state right of conscience laws? And while you're filling that out, I'll note we've started seeing now more people who are objecting to even COVID testing because of their religion. And we'll touch on that a little bit later, but it is something to keep in mind, and it's something that you'll see come up from employees who are making those religious exemption requests. So let's see where we're at here. Well, many have not received those kinds of requests, and that makes sense. There are some states that won't have these right of conscience laws. Others are still kind of managing the process of how to handle those, and that makes sense because, again, we'll get some guidance from the federal government likely in the month of October. With that, I'll turn it over to you, Barb.
Great, thank you very much. This is the part of the presentation where I'm hoping my colleagues will jump in and give their 2 cents, and hopefully we can answer some of the questions that have been coming up in the chats. We're approaching, looks like 100-some questions already. So, we keep talking about United Airlines, some of these other organizations that you see on this slide. United is reporting, I think 99% of their workforce is now vaccinated, 600 people they're going to have to let go. But I think what that isn't telling us is how many of the vaccinated are actually vaccinated or are exempt from vaccination because of religion or disability. And so in my experience, I'm starting to see, and I'm really starting to wonder how much of a kind of black hole is this religious exemption creating? So when they say 99% of their workforce is vaccinated, what part of that 99% is unvaccinated with a proper religious exemption such that they are being tested and masking? And I think those are numbers that are hidden. I think we see the possibility that this religious exemption, because it is so vague and general, could almost be something that swallows the rule. So let me talk a little bit. Let's start with, Is your organization already subject to a state or local vaccine mandate? And probably if you're in healthcare, the answer may very well be yes. Your choices are yes or no.
We are getting, while we're waiting on those, Barb, we are getting additional questions on dealing with the like sort of fake or things that you appear to be fake religious reasons. I think, you know, we kind of touched on this already, but people are wondering how to handle this. I think on the one hand, and this is like the United Airlines situation, if it's an objection to the vaccine for religious reasons, you sort of have, you know, an alternative that also is safe and works, which is maybe you grant that accommodation, but you require them to test and mask, or even maybe to go on some kind of temporary leave. I think it gets trickier when someone's claiming they can't get tested, or someone else mentioned a question about, is there a real valid religious reason not to wear a mask? There may be some limited situations where that really is valid, but it definitely gets trickier. And I think that's when you probably lean more, you know, you rely more on the undue hardship analysis. So if you were to grant not only an exemption from the vaccine, but also allow them to come to work unvaccinated, not testing and not wearing a mask, then you're in the undue hardship realm, and you have much more solid ground to take action at that point and deny the request.
And I would be very, very careful saying that somebody doesn't have a sincerely held religious belief because they've obtained information or documents off of the internet, because they have a form letter that's been provided by a church. We are seeing form letters by all different denominations. We are seeing form letters from online churches. And I think you would be in a very dangerous territory if you just set up, it looks like they purchased this online. It looks like a standard form. I'm going to deny it because I don't believe it's sincere. So I think you're right. I think the ultimate play is with whether it's an undue hardship. So let's see. We have so far just a quarter of the folks attending this seminar subject to a state or local vaccine mandate. It's coming, whether it's state or local or ultimately federal. And so here's one more poll question. Have you held off on implementing a vaccine mandate in hopes that the federal government would issue one first? Yes or no? And the reason that we're asking this question is there can be some pros and cons to going first, right? So if you wait for the federal government, and depending on where you are in the country, you have the ability to blame this on someone else, essentially. You know, if you go first, maybe, you know, you create some staffing issues, people leave because they want to go somewhere else that doesn't have a vaccine mandate yet. But you may also want to go first, or at least start getting ready to go first, because it's a lot of work to get there. I mean, what does your workforce currently look like? If most are vaccinated already, then what's really the harm to mandating it and going first? So let me give this one just a minute more. So we are pretty neck and neck about people who have held off implementing or waiting for the government to go first. So in the chat, it would be interesting to hear why you all are thinking that. I certainly, with a lot of the clients I'm working with, there is a significant staffing concern. There's a concern that if you implement a mandate, some of the healthcare workers, particularly CNAs, are going to just leave the profession. I have a lot of clients that are saying, no, we want to be 100% vaccinated. We want to advertise ourselves that way. In Colorado, we are supposed to be, according to the Department of Health, 100% vaccinated. And so I think it really depends on a number of factors unique to your organization. Next poll question then. Approximately how many requests for religious exemptions related to COVID-19 vaccination, whether it's testing or mask mandates, has your organization received as a percentage of your workforce? So again, this is following on what we have observed at Husch Blackwell, that we are receiving a large number of religious exemptions, many fewer medical or disability related exemptions at this point, but a large number of religious exemptions. So benchmarking as to your total workforce, what's the approximate percentage of the religious exemptions that you're seeing? And then there is an option if you haven't received any requests based on religion, I know some people answered that earlier, then you would click the NA.
And Barb, I would just add that anecdotally, clients that I'm working with in the healthcare industry in particular have seen not only an increase in religious accommodation requests as to the COVID vaccine, but also the flu. And they can compare it to past years when they mandated the flu vaccine, and significant numbers of religious accommodation requests, and particularly in advance of impending deadlines.
Okay, it looks like our responses have slowed down. So roughly, looks like of the people that are receiving these so far, it's roughly 20% of the exemption requests are these religious requests. And Julianne, you know, I actually, I think sometimes what I'm seeing with the flu now, I'm learning that a lot of people would get the flu vaccine because that meant they didn't have to wear a mask. And now that everybody's wearing masks, sort of takes that, that reason away. Let me have one more poll question here, and then we'll get to kind of the common issues slide. So approximately how many requests for religious exemptions to this vaccination, including testing or mandates, has your organization granted as a percentage of your workforce? So we just covered how many received, and that was roughly 20% was the biggest number. How many granted? In other words, are you typically granting these? Are you finding yourself denying them? What do those numbers look like?
Barbara, the results are coming in. I would say to your last point about employees seeking exemption from the flu vaccine too, if everybody's got a mask anyway, one of the trends that I have seen in speaking to clients that I work with is that employees may view it against their interests in seeking an exemption from the COVID vaccine if they don't request an exemption also from the flu vaccine. And in that way too, the number of accommodation requests is higher than predicted.
And so Julianne, that is on my next slide with a little bit of a different twist, which is, I think, an unintended consequence of the COVID-19 vaccination religious exemption discussion that we're having right now is a lot of people who are going to say, okay, well, now I realize that, for example, my body is a temple and I should not be getting a vaccination. I'm no longer going to get the flu vaccination either. And so it is, I think, from a public health perspective, it has the potential to create a lot of unintended consequences. So here we have it, you know, this is completely unscientific, but it sure looks to me in looking at the responses to this one that if up to 20% of your requests, if you're getting 20% religious requests, it looks to me like you're granting them. If I'm reading that wrong, please let us know in the chat, but it doesn't look like we're seeing a whole lot of them be denied, or at least at this early stage with a lot of folks not having mandates. Okay, so this is sort of some common issues that we put together, and it addresses, or it like raises some of the questions that you all have raised, and I wish we could give certain answers. So I've definitely seen questions in the chat and in dealing with clients and talking with my colleagues. We're getting a lot of these religious exemptions that are based on what I would call faulty science. Maybe they're mixed motive. So they talk about what the person believes to be the science of the COVID vaccination. It's got aborted fetal cells in it. It's going to change my DNA if I take it. Things that I think are very scientifically proven to be incorrect. Yet the person takes that and turns it into the reason why, for a religious reason, their sincerely held belief, they can't be vaccinated. And we're seeing a lot of it with the development and or testing based on stem cell fetal lines. And so we're also seeing objections. The vaccine is experimental, and we all know that that's not true. And I think, or at least for the Pfizer vaccine at this point. So I think the question is, what do you do with these mixed motive, faulty science exemption requests? You can present, and you should present, the true science. You should be constantly educating. But what do you think, Tom or Julianne, about denying an exemption request where the person says, I sincerely believe that I cannot take something that has been developed or tested with fetal stem cells. My sincere religious belief is that I can't do that. Do you deny the request based on sincerity, since its underlying has some level of false science associated with it?
Well, this raises the arguments used by the Conway, Arkansas hospital, in which they provided education to employees who sought religious exemptions based on the fetal cell line arguments and the aborted fetus arguments, pushing back by educating employees on the fact that common over-the-counter medications were also developed using fetal cell lines, and asking whether you will, if you do, or will you in the future use those over-the-counter medications as a test of the employee's sincerely held religious belief. I have worked with clients who are using sort of a similar method of pushing back, but ultimately probably not denying the sincerity of the religious belief, and instead focusing on the undue hardship of accommodating that person.
Yep, I echo everything Julianne said. It's interesting because someone in the chat just commented about how they're not getting any religious exemption requests. It's all just based on misinformation. And I think education is one of the more important roles that an employer can do in order to move your vaccination rate higher and higher. With a lot of these objections, they may be based on misinformation. But at the end of the day, I too wouldn't necessarily go the sincerely held route of challenging it. I would look more to that undue hardship route of saying, we just can't accommodate that, and put them on unpaid leave, do something where they're not necessarily patient facing, but take some other step based on the undue hardship end of the analysis.
And I am no scientist, and I'm not sure if Michael is, but a shout out to Michael, who had a comment in the text earlier about this gene therapy altering what God made scientific argument that we are hearing. According to Michael, he's had success sharing information about the J&J vaccine, maybe not having that same mRNA component or issue associated with it. So if the science is true there, that's certainly another educational point that you can push back on. But it sounds like our panel is saying, tread carefully, even if this the science underlying the sincere belief is objectively false, there is still a sincere belief for that person, and it would be risky to challenge the sincerity. We've had a lot of questions about objecting to testing as a reasonable accommodation. I know I have seen what would be considered to be some kind of medical request for exemption to testing related to what's on the swab that you're sticking up your nose. That's not really the religious issue. And I'd be curious if any of our panelists have had religious objections raised to the actual testing of it. The other thing that I'm seeing with the testing as a reasonable accommodation is a lot of arguments about, well, you can make me test, but the PCR testing isn't necessarily accurate, and even vaccinated people can carry the virus, and I don't have informed consent to do testing. It's discrimination for you to make me test because I have obtained this religious exemption. And in my view, none of those are religious. So the efficacy of testing as an accommodation isn't really what we're talking about here. It's whether, if we have decided to accommodate a sincerely held religious belief, whether the accommodation of testing and masking is appropriate in the opinion of the employer. Do any of the panelists have any thoughts about that? No.
To me, I think you can.
I was just going to ask if any of you all have run into a religious exemption to testing. I think masking, we're familiar with some of that, which is the fit of a mask and maybe facial hair. That's so 2020. But are we, any of us, running into the testing as a religious exemption?
Yeah, I think I'm starting to see that more, and for all those reasons that you identified, I think that becomes, also, moving into the undue hardship analysis, and I think there's also more room to say, push an employee to identify why their sincerely held religious belief doesn't allow them to be tested. They may articulate some of those reasons, but then I think you move to an undue hardship analysis, just again, given the potential for a vaccinated employee, particularly in healthcare, to be there treating patients or interacting with other employees or the general community.
I was going to add too, I'm sorry I was lost for a little bit, but so I hope you didn't already say this, but I think that if you push back a little, in order to get some documentation, or like Tom's saying, maybe it leads to a discussion where, they explain it's not actually related to the testing, and it shows that that's not the right accommodation. Another thing is, depending on the volume, or if these requests are all starting to look like the same or copycats, then it may, just having the discussion and pushing back a little, even if you ultimately don't question the sincerity, could also deter others from coming forward if they're not sincere. I think it could, have at least the effect of saying we're not just going to accept these at face value. Potentially, if you don't go too far with it into the wrong place, then it could have that desired effect.
So I see that we're at 2 o'clock, but I think unless somebody unplugs us or turns us off, we should probably keep going for a little while. The next category of things I wanted to talk about are sort of the unintended consequences of what we're going through right now with this big bucket of religious exemptions to COVID. We talked about the public health issues, and now people are going to say, I can't get the flu shot either. Julianne mentioned the Conway Regional Health. So many of our modern medications are developed or tested in the same way using these fetal stem cell lines. And so when we ask our employees to verify that they're not going to use any of those medications either, either they're going to lie and tell us they're not, or they actually aren't. And so are we encouraging a large segment of the population to stop taking medications that are generally very helpful? I think there's to me, this religious accommodation issue almost comes down to a business decision. There are many requests where you could decide that, yes, you're going to accommodate it, or no, you're not. And so what is your staffing need? What, if you grant the requests, you're not going to get sued by an employee. So what's on the other side of that? Why wouldn't you grant it? Are you concerned about the health and safety of your workforce or your patients? Or are you more concerned about the staffing? So I think a lot of this ends up coming down to a business decision with the values of the organization on how much flexibility you're willing to give, how you analyze that undue hardship in your organization, and how flexible you want to be with these religious accommodations. I do think you're setting future precedent for religious accommodations. So if I've been granted the ability not to have the COVID vaccine, I think you're setting precedent for the flu vaccine as well, unless there's some scientific different reason that supports the religious request. You also have a lot of employee information, whether it's religious or health. You're risking disclosing that by, if you're granting the exemption, you're now in possession of all of this information about your employee that you might not have otherwise. So I think there are long-term consequences for employers to be considering as well as they go through this process. Anything else on this from our panelists? It looks like some folks are asking for Conway Regional Health for the list of medications. I think if you Google that, that's been written pretty widely about. You should be able to find that. And if you don't, just reach out to us and we can send you a link to that.
One other and maybe a more kind of global comment as we look to wrap up, and certainly if folks have questions, feel free to share again in those question boxes and we'll try and get to those. But there are a lot of questions related to the religious exemption, and the Equal Employment Opportunity Commission at the federal level hasn't, I don't believe, commented or given us any frequently asked questions or guidance since I think it was late May. I fully expect that OSHA and CMS right now are communicating with the EEOC and asking for, and the Biden administration is pushing for some more guidance. And that would be helpful to employers. And to the extent that you're all part of association groups or other organizations that are active in lobbying and working with elected officials, I think that'd be helpful to have some more definitive answers that employers can rely on moving forward. Otherwise, we have to wait for litigation and wait until we get some courts weighing in on these issues, which won't be for a long time and will obviously result in some significant costs for one or more employers. So I expect we'll get some guidance. I have to think that they will offer some thoughts related to some of these common objections and common issues that employers are running across, especially when most of the economy has to require a vaccine sometime in the next month or 2 months.
And Tom, following up on that, we have an audience member asking how it could not be an undue hardship if healthcare facilities will be denied Medicaid and Medicare funding for the unvaccinated. And that is an excellent question. And that's why every time we are granting a religious exemption request, we're including language that says, we'll do this for now, but this is subject to change based on a host of factors, including new federal, state, local regulations, the numbers of people that are availing themselves of these religious exemptions. It may be that testing and masking, once you reach a certain critical mass, is no longer a reasonable accommodation. It becomes an undue hardship because there are so many unvaccinated people in the workplace. So I think it's really important to make sure that these are granted on a temporary basis. I don't think you have to put an end time on them, but I think you need to make it clear that our consent, our agreement to this may change at any time based on changing circumstances.
Yep. Well, like we said, we're pushing, 150, 200 questions that are kind of flowing through. We've tried to touch on some of those. Obviously, it's an issue that will continue to play out over the next couple weeks, months. Just note that when we do have that regulation issued by CMS and or OSHA, we at Husch Blackwell do intend to be on top of that right away with the webinar following very quickly with client alert even before that. And we'll address these religious exemption questions and others that are identified in those new regulations that are forthcoming. So in closing, thank you very much for joining us today. Again, we really appreciate the 1,300 or so of you who registered and joined us today with all those questions and all those insights. As a reminder, the program has been approved for legal education hours. And to report those hours, click on the CEU button and icon at the bottom of your screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with the recording of the webcast for watching and sharing. And then finally, you'll have a short survey after we're done here. Again, we use that survey in order to plan feedback, including feedback that folks wanted to hear a little bit more about the religious exemption, which we're happy to provide to you today. Thank you very much again for joining us. Thank you for your time. And this concludes our webinar. Have a good day.